Thanks for joining today. As you know, I'm Moki Macias. I'm the Executive Director for the Policing Alternatives and Diversion Initiative in Atlanta. I work closely with our police department as well as with our city non-emergency services line, our 311 line. And so I've been tapped to help coordinate this working group, really as a way for us to host conversation around how these other lines, whether that's 311, whether that's 988, as folks know is coming online next year, or others that are more location specific, how those lines are interfaced with 911, what the pros and cons are of people engaging with other public service lines. So that's really our hope. We'll start digging into that just a little bit today. And here I see my co-chair, Mariela here, but Mariela, I'll just continue with my introduction real quick. The question that we were asked when we first got involved was, why is this work so important to us in our particular roles? And I will just say for myself, I think what has been really critical for us in the work that we're doing to provide alternate responses is having that really strong partnership with the folks that are actually receiving calls from community members through 311 to understand the concerns that they have and the concerns that they're hearing from community members so that we can effectively respond. And I know that as we look in Atlanta at how we are maybe continuing to offer resources through the 911 system, that continues to be a hugely important thing. But Mariela, if you want to go ahead and introduce yourself.
Sure. Hi, everybody. I'm Mariela Ruiz-Angel. I am with the city of Albuquerque. We, about a year ago, decided to create an entire cabinet level department that is focused on alternative responses. So this, we are at this point where we're implemented. Our units and responders are made up of social workers, clinicians, peer support workers, and so many other across the behavioral health spectrum. And so we're really fortunate that we've been able to start this. But one of the challenges that we had as we developed this and as we're even implemented is making sure that one, we keep our relationship with our police and our 911 dispatch, as well as our fire department dispatch, intact. And part of that is challenging them in a way to start looking at calls in a different light that allows us to be able to take some of those calls that are really overburdening, at least here in Albuquerque, where we're lacking police and we're struggling to keep our police officers, and how we can help them by taking some of those behavioral health calls that they're not really wanting to go to begin with, they're not also equipped, and that take a ton of time, in which we could really have them being out in the field responding to violent crime. So with all that said, this is a very important conversation for myself and my teammates who are also here, because we want to learn, but we also have lots to share about our current situation and how we're able to navigate through our current 911 system, and how we continue to have those relationships and try different types of strategies. So very excited to be here. And I know these breakout rooms go fast, so I think we should jump right into it, Moki.
Sure.
So I think we wanted to go over the overview, and I don't know, really it was about, the entire conversation is really going to be around exploring 911 hotline to alternatives. So, right, different types of ways that we're doing this, whether it be community-based, city government, or even as we're thinking about the bigger picture, many of you have been in the 988 conversations that are happening. So we want to hit on a couple things today. We want to talk a little bit about strengths and limitations of alternative crisis lines or hotlines, including our 211, 311, and again, that 988 text lines, you name it, medical. We'd also like to assess how hotline alternatives, right, or 911 may address or exacerbate structural, implicit, cultural bias, harm, inequities, how it can also reduce overly punitive applications of and/or unnecessary enforcement, and how do we improve criminal justice and health systems and their outcomes. So we'd love to hear about that. I think on our last breakout room, we wanted to hit the questions and we didn't get to. So I think we'll jump in now. I think if we can go ahead, and there's a link in the chat, and we'll go ahead and jump into some of these questions, and hopefully we have some time for discussion.
Great. All right. So I want to just actually, given the conversation that has been coming up in the chat, I want to also encourage people to share their thoughts related to, you know, what success looks like, but also start to think about what your interactions have been from your experience, if you have experience in this area, or from your jurisdiction, just to start thinking about, you know, where do these other lines come in, and what are some of the, you know, the pros and cons of having other public service lines that are interfacing with 911.
I see some real healing. Mm-hmm.
I think
let me know when you want to move to the next screen. We have another question too when you're finished with this one.
Sure. Thank you. I just wanted to point out the idea of no wrong door, right? As well as the idea of no transfers, but then also this concept of other numbers to call, you know, that I think that those are all really relevant to this question of how these other lines intersect.
I also really like the flexibility. I saw that, which I think is really important. I think a lot of these types of responses, you kind of have to, these are SOPs, right? As we think about when we're working with police and fire. Great. So
Awesome.
let's move on to the next one. Consistent.
Great. So, so again, you know, to be able to pop I see some folks are answering this in the chat. Others may be using the Mentimeter. I think that if we could share the link to the Mentimeter one more time, that might be helpful. So for this specific work group, to the question of these, you know, interfacing with other hotlines, what questions do you think we could tackle together? So I see evaluation, what the demand is, and, you know, whether there will be public uptake of those numbers, the buy-in. Yeah, getting to this question of, you know, how, and I think this is coming in the chat in other sections of this event, but, you know, how the public chooses to use 911 and what their expectation is when they do, you know, is something that, you know, that probably involves a lot of other stakeholders, right, in terms of really educating and changing of community expectations if it's being used as sort of a way to try and control or punish.
Can we scroll down a little bit and look?
I am trying to see if we can do that. Actually, I can't seem to find that feature, so I'm going to work on that.
Okay, and if folks in the meantime want to add additional thoughts in the comments in the chat function, please do.
Or we have a little bit of time, but if anybody has like a really burning question that they might want to even just bring up, I think right now would be a good time too. I think that was our second main question.
And there are some other answers. We do just have to scroll down manually to do it.
Great, great. Yeah, super, super important questions, right? You know, that collaboration with 988 as a huge new resource that will be implemented. That question of how, you know, what are the other responder teams that are available, such as street outreach, and then this critical issue of, you know, the downstream resources are really, that's where the rubber hits the road, right? That when people make that call, what are the other options available? Mm-hmm. And then the question of the call takers asking, you know, how they're vetting calls, especially if there is a way to then transfer between call lines. I think, you know, that'll come up often. Someone also in the chat, this question of who the hotlines are accountable to, and I think that there's some sort of cross conversation there with the folks that may be thinking about governance of the 911 system, right? But again, governance issues related to how all of these systems are responding to the public.
You want to scroll back up, or are we finished with this one?
So 988, just I saw that one pop up. It will probably be different in most states. It's right now, I think each, depending on what they already had in place for crisis lines, it's my understanding that folks will be adapting to their resources currently within their state. But we'll see how that rolls out next year. I think that's a big one. So I see this one. It's like, what questions should call takers ask to get that person appropriate response?
Yeah, thanks. It's just a lot to type, but I think one thing, at least adoption of less lethal alternatives to or tools like stun guns. It expands the continuum of physical interactions rather than replacing what exists. And so as we look at revising 911, how important it is to look at the possibility that that actually may expand control, especially in Black and Brown communities of the state, rather than replacing what we currently.
Yeah, thank you for that comment. I think it, you know, it is that is why the sort of cultural change around, you know, our expectations of what happens when we call 911 really makes I think a huge piece of this conversation, right? That it is not simply continuing to sort of expand an enforcement mechanism, but to do something different. I also saw a comment in the chat about addressing cultural competency, and, you know, knowing that this sort of varies across, you know, the training and expectations vary across jurisdictions, certainly, but getting to this question of how, you know, getting to the place where anybody who calls 911 is able to, you know, to know that they will be responded to in the way that they need to, you know, and this gets, I think, to some other questions related to, you know, people's identities, whether that's cultural, racial, ethnic identity, whether that is, you know, folks who are speakers of languages other than English and additional language services, folks who are hard of hearing, right? It gets to a lot of questions of is 911 for everybody, and how can we continue making it be a resource that is for everyone?
Any other thoughts or questions or ideas?
Okay, so make sure we're on time here. Yeah, and so, and this other question of, you know, how do we create what a community needs versus what we think they need, right? There's been so much demand for for additional resources, right? And other ways of responding. But how do we make sure that we're actually then building those things out and listening to folks who are doing the responding, but also making those phone calls? I think that's a critical piece. Some of these hotlines, there's examples of hotlines that are being set up outside of the public system because of that demand. I think that's something for us also to consider as a group. It's just considering, the pros and cons of systems that are not, that are being sort of run by independent organizations as a way to respond to community need, but at the same time, sort of lacking then the, a stronger ability for oversight and for standardization. So that might be something that we want to look at as a group to kind of deal with some of these questions.
I had a quick question if I could jump in. Hi, Brianna Osteen from Mark 43. I was curious, as you all are setting up these new models in your jurisdictions, like what evidence-based practices are you looking to help inform like the systems that you're putting into place, or on the evaluation side, are you working excuse me, with anyone to help you kind of do process evaluation to see, as you're rolling out these programs, do I need to change or iterate or adapt a new strategy along the way?
So Moki, you're a little farther along, and I think you had a great evaluation process.
Sure. So, what's the word? Receiving a lot of data about, the calls that we respond to. We are asking folks to complete surveys once we've done a call with them. We're comparing our data then with the 911 call center data, with the 311 and not 911 call center data, to try and kind of see, are the calls going to 311 actually shifting anything at the 911 system? Are they seeing less of certain kind of calls, like, public indecency calls, for example, and then, what impact that has had sort of down the line. I think the other piece there to think about is just, is the kind of follow-up that these smaller initiatives are able to do, right? So when people call us, we're able to we do a follow-up call with folks. We give people some understanding of what happened when our team actually went out, while respecting people's privacy. But I think that gives us an opportunity to really hear from the callers, like, how did that go for you? Did it work out when we called? Did you feel like you got your questions answered? Were you able to share all the information you needed? So some of that is just building in the opportunity in these smaller pilots or initiatives to get that just feedback directly from the callers, which I think can be really helpful.
Agree. And we're, Brianna, we are actually going to be trying to use Mark 43. So we felt that it was important, although there has been a lot of discussion around data sharing and what we don't want necessarily our police department or our fire department to have access to. We've been able to make that work with Mark 43, and that comparison, at least for the city of Albuquerque and justifying these types of programs, is really important, because right now we are hurting in our police department with staffing police, and our call waits are out of control. So it's really important for us as we think about alternative types of response system, right? I mean, if we can get out to a call that normally takes 4 to 5 hours in 15 to 20 minutes, that's a huge success for everybody involved. So that's what we're hoping to really start showing through our current data intake, but then additionally as we grow into a Mark 43 process.
And Mariela, because we've had so much conversation in the chat about 988, would you mind sharing a little bit about what your planning efforts have been to make sure there's that connection?
Sure. So at least in the city, the state of New Mexico, our 988 is really concentrating on separating themselves from 911, which we think it's probably a good start. However, as we've moved forward, we are now going to have to figure out how they're going to integrate into 911, which we always knew would probably be a situation. Ideally, it's going to run like a crisis line. So you call 988, and if it's something that can be handled via the phone, you'll be able to get somebody 24/7. But in those occasions where you'll actually need a responder, at least for the city of Albuquerque, and then for other small cities in which have alternative responses, they'll be able to send out a behavioral health response. In some situations, we do anticipate that some of those calls will still think about 988. There will be a time where we'll have to integrate that 911 so that fluid, right, so that it's back and forth. Hopefully what we'll see is 911 and vice versa. So that's how we're implementing. We don't already have some sort of, we have a couple major crisis line hotlines, but they're not large enough to sustain the entire state at this point. So this is going to kind of be a big game changer for us, but it will also challenge, and I'm sure in other cities, states and cities who are doing this, is it will challenge the continuum of care and the system of care as we think about are providers ready for this kind of boost in additional calls. So lots of things to figure out. I'd love to hear from other cities. I saw that there were some folks who have been on those calls too.
Yeah, anyone else with in another place that wants to speak up, and anyone wants to speak to, the 988 process, or if there's any other hotlines that you're currently intersecting, with your 911 system.
Moki, this is Shannon from NAMI, and I just want to jump in for folks. I realize that there's a lot of information on 988 and there's a lot of uncertainty around it. And what I'd encourage people to do, and maybe they can do through this network, is to just continue to stay involved and continue to stay alert, because this is changing all the time. What was true 4 weeks ago, and I work on this is 3/4% of my, this is 3/4 of my job at NAMI, is really kind of pushing some of the rollout on 988. What is true now is not going to be true 4 weeks from now. There is money that is potentially going to be rolling out to states through Congress. There's a lot of states are, fired up preparing for their next legislative session, in which a lot of these, I think, systems are starting to roll out. So I would say just continue to stay involved where you're at, because I don't want anyone to hear what 988 is here and then think that that's how it's going to show up next summer, because we're doing a lot of work and it's changing all the time. So, but I really appreciate this conversation. It's been super great to listen to all of this.
Thank you so much, Shannon. You're 100% right. We've actually, in some cities, we were just in, I believe, Phoenix or Tucson, and they already have the infrastructure to just throw it into 988 will be their new number, which is fantastic. That is not the case, I think, for a lot of other states. So yeah, I'm very excited to see what this will be for lots of places and how this will change. But 911 took years upon years upon years to get folks to start utilizing that. So, I think we still have a long journey ahead of ourselves.
Yeah, I'm from AFSP and I work with all 50 states, and while my job is state policy in general, it's been mostly 988 for the past 6 months. And I just want to echo what Shannon said. It's hard for us to keep track, but also in the states where there's really not funding and no structure, it's a good opportunity for them to put the mobile crisis in place. And so we are working to try to, in some states, to get funding that's reliable and steady year to year, rather than relying on grants in the budget year to year. And I just wanted to say that I think if we could work with some of you or your groups, those answering the calls, when we have support from police, it really, really helps us with legislators and the public and state agencies. So I just wanted to throw that out there, that I think joining forces would help both of our cases for 911 being better utilized and then 988 being utilized for what it's for.
I agree. And it brings up a whole other, it's much larger, right? If we're seeing the funding for 988 responses, we think about the kind of funding that we'll need long-term as well to sustain. And additionally, it goes to that other piece, as how is that funding also then coming down to bolster those providers and those nonprofits who are also going to be taking on additional burdens to be able to, right? It's going to be a lot of work for them. So it's really about how we're going to see money being put into community, as well as we see that we're going to need to lean on those folks. going on. So we have a couple minutes left. Anything else? I mean, I think this has been a really good conversation. I hope that we can continue to have these conversations as we move forward. I think there's been a lot of conversation about alternative responses, but now that a lot of us have been doing it, I think it allows us to really hone in on those areas that we really know, like 911, on how we can really, how we can really find that balance.
All right, we have just a couple more minutes. Anyone else want to share a last thought just on how 911 can work with these other lines? I do see a comment here about what happens if police keep getting summoned to the same address over and over. I think it's a great question that really is relevant for this group, as well as this question of, you know, the different types of responses, right? Because sometimes police don't have the resources to be able to do the follow-up calls to come back out and outreach, but another provider may be able to do that. So whether that's dispatched through 911 through a different line, it's really trying to pair up the appropriate response teams with the way framework for us to think about as we engage in this work together. There's a lot of great comments in the chat. We're going to get all of this information and do some pre-work before our next convening, but I would just encourage people to go to the website to be able to sign up for our work group. This is our official pitch to come hang out with Mariela and I to dig into these questions a little bit more. I'm putting it in the chat here. So if folks want to join our work group, there will be a lot more structure and engagement in the next one. This is sort of just the like, what are all the things, and inviting y'all into conversation with us. So I really appreciate the wisdom and interest in the room.